all of that because it really does ground a lot of this conversation as well as your journey into the work that you're doing. And you illustrated a lot of it very well. I kind of just want to hear more about maybe the interactions that you've had growing up with the elders that you said you were around a lot, and when did it maybe click for you that there were like injustices that were happening, or was that something that you realized from a very young age?
Very young age, I think, just having that exposure and those stories so early. Again, growing up in the South, I didn't grow up in kind of, the places where we kind of historically associate with civil rights. So I grew up asking a lot of questions. I remember being very, maybe 3 or 4 and learning about and talking to my grandpa about presidential elections, which is incredibly young. For example, my grandfather was one of my grandfathers was one of the first Black police detectives in a relatively small town. And so then you start asking questions about what was that like for you and digging into that. And so understanding that folks just have a journey and that there are a lot of traumas. And I feel fortunate that I have folks I was around who were willing to talk about that and talk about the intersection of race and trauma, but also the joy that comes with, especially what it means to be a Black person and what it means to be a Black person in the South and persevering during times of, struggle, and being able to recognize the struggle, but also celebrate the beauty and the uniqueness of our experiences. And I think that really helps shape kind of um, how I view a lot of things related to policy and structures, and recognizing again that there are opportunities certainly at the individual level, but there's so much power in being in a space where you can change things to make things better for folks. So those aren't necessarily specific experiences, but just kind of just the privilege of being able to be around people who have lived and want to and are willing to give you the space so that cycles can be broken and you can think of things outside of yourself.
And highlighting the point of the importance of just sharing narratives, sharing stories, because like we think about dates all the time and we think historically, but like how can we relate to the stories? How can we relate to the data points? And I also just want to also highlight the point of you sharing that, like, because many times we think of a lot of issues that people face, especially Black people, tend to be individual issues as an issue with the person. But then when you think about the story where you say your family was trying to get ahead and they try to move into this complex, and from that there were health consequences that came with that, and it just shows like even when individual people are making moves to improve their and their families' lives, they are systemic structures and policies that are in place that are doing things to harm them and oftentimes harm their health. So wanted to ensure that we put a pin in that as well. And just getting into this other question. So like as director of policy at the Trust for America's Health and with all your experience, can you share more about the intersection of public policy and health disparities?
Absolutely. And that's a great segue. I mentioned obviously so far that I'm really passionate about recognizing the power of public policy. And I think there are so many people who do the quiet work of policy, not, necessarily legislative decisions or people who are in elected office, and not even folks who are the faces of executive agencies, but the folks who are really passionate about where they can fit in and make a difference and understanding that I think, especially for myself as a Black person and a Black woman specifically, I think a lot of folks think it's pretty easy to separate, again, kind of these individual level choices and decisions from systems and structures. But